Your vet is about to inject your cat in a spot chosen for one brutal reason. If it goes wrong, that leg can be amputated to save her life. Clinical immunization requires a cat's immune system to recognize a threat without being overwhelmed by it. The goal is to induce long-term protection while minimizing the specific risks of localized inflammation or rare oncological complications. To manage these risks, the American Animal Hospital Association and the American Association of Feline Practitioners provide protocols that categorize vaccines based on life stage, lifestyle, and regional disease prevalence. These protocols rely on introducing isolated antigens, parts of a virus that cannot cause disease. The cat must be healthy and afebrile, with a standard body temperature near 101 degrees Fahrenheit, to ensure the immune system can respond effectively to the injection. Veterinary decisions are organized into 3 distinct categories, identifying the specific pathogens involved. Timing the doses to match the cat's age and mapping exactly where on the body the injection is placed. Understanding these 3 data points is necessary to ensure the animal receives the maximum protection with the lowest possible risk. The pathogen profile begins with core antigens. These are recommended for all cats because the viruses they target are highly transmissible, stable in the environment, and cause significant morbidity. The most frequent core requirement is the FVR. Combination FVR refers to feline viral rhinotracheitis, caused by feline herpes virus. It replicates in the nasal and conjunctival membranes, often leading to sneezing, hypersalivation, and painful inflammation of the eyelids. The C stands for calicivirus. This pathogen targets the respiratory tract and frequently causes ulcers on the tongue and mouth, which can progress to pneumonia in young kittens. The P represents panleukopenia, a feline parvovirus. It causes severe viral gastroenteritis and has a high mortality rate, particularly in kittens and cats in high-density environments. These 3 viruses are so prevalent in the environment that most cats will likely encounter them at some point in their lives, making their initial immunization a standard medical requirement. Rabies is the final core antigen. It is a killed virus vaccine that prevents a fatal infection of the nervous system. Because rabies is transmissible to humans, its administration is often governed by municipal law, in addition to clinical health guidelines. Beyond the core requirements are non-core vaccines, such as feline leukemia or FILV. This retrovirus suppresses the immune system and is a leading cause of cancer in cats. Before vaccinating, kittens should be tested for FeLV around 12 to 15 weeks of age. If a cat is already positive for the virus, the vaccine provides no clinical benefit. Lifestyle significantly impacts the risk level for FeLV. Cats that live exclusively indoors have a much lower chance of exposure, estimated by some research to be as low as 1%, allowing the booster to be discontinued in many adult indoor cats. However, even indoor cats require FVRCP and rabies. These viruses can enter the home through accidental escapes, human clothing, or legal requirements for boarding and travel. Selecting which pathogens to target is a process of balancing a virus's severity against the specific risks of the cat's environment. The second data category is the immunological timeline, which explains why kittens require a series of boosters. Between 6 and 16 weeks of age, newborn kittens receive passive immunity from their mother through the placenta and colostrum. These maternal antibodies provide immediate protection, but they naturally degrade over the first few weeks. While these antibodies protect the kitten, they also neutralize vaccine antigens. If maternal antibodies are still present, they will destroy the vaccine before the kitten's own immune system can learn to recognize the virus. To overcome this, veterinarians administer boosters every 3 to 4 weeks. This ensures that as soon as maternal protection drops, a vaccine dose triggers the kitten's long-term immune response. For adult cats, boosters are typically moved to a 1 to 3 year rotation. Research indicates that in some individuals, the immunity from these early doses can persist for several years. To avoid unnecessary injections, clinicians can use antibody titer testing. This measures the concentration of antibodies in the blood to determine if the cat is still protected, or if a booster is actually required. This schedule is a deliberate attempt to time the vaccine's introduction to the exact window when the kitten's immune system is first capable of responding. The final category is topographical mapping, which dictates exactly where on the cat's body a vaccine is administered. Historically, vaccines were often given in the scruff, or the loose skin between the shoulder blades. However, current veterinary standards strongly discourage this practice for felines. This change follows the identification of Feline Injection Site Sarcomas, or FISS. These are rare but aggressive malignant tumors that can develop at the site of an injection. Often linked to localized inflammation, these tumors are highly invasive. If a sarcoma develops on the back or shoulders, the proximity to the spine and lungs makes complete surgical removal difficult and often impossible. To improve survival rates, current AAFP guidelines require vaccinating as far down the legs as possible. If a tumor occurs on a lower limb, the area can be surgically managed through amputation, which is often curative. Clinicians follow a standardized map. FVRCP is given on the right front leg, rabies on the right rear, and leukemia on the left rear. This consistency allows any future issues to be immediately linked to a specific vaccine. This mapping provides a critical surgical option in the rare event of a localized reaction, prioritizing the cat's long-term safety when these 3 factors, pathogen, risk, timing, and location, are combined. They form a comprehensive plan for feline health. Modern protocols are the result of decades of data on virology, maternal antibodies, and surgical oncology. We select vaccines to address the most dangerous diseases, time them to bypass maternal interference, and place them where they can be most safely managed if a complication arises. Following these steps significantly reduces the prevalence of once common diseases like panleukopenia and leukemia, supporting a longer and healthier life for the animal. Effective veterinary care relies on these evidence-based steps to ensure that routine preventative measures are as safe and effective as possible. If your cat's next shot isn't going in the right front leg, the right rear, or the left rear, ask why. That mapping is the difference between a treatable problem and an inoperable one. Subscribe for the vaccine safety details vets don't explain in a 15-minute appointment.